Hi guys, welcome to week 1. We're going to be discussing the reading from chapter 51, pages 1121 through 1126. The remainder of the chapter will be broken down into weeks 2, 3, and 4. For now, we'll be sticking for this very beginning part and discussing sort of the history of pharmacy, medical assistant's role in pharmacology, and some definitions that'll help you understand more about what pharmacology involves. So our learning objectives will be, sorry, seems to be stuck a little. I think I took the learning objectives out. Regardless, our learning objectives for this short section will be to identify the medical assistant's role in pharmacology and recognize the 5 categories of pharmacology and their importance to medication administration. So what is your role as a medical assistant? Retaining to pharmacology, it is to ensure licensed practitioners aware of all medications a patient takes, so taking an accurate and detailed list. This will include both prescription medications and over-the-counters, as well as vitamins and herbal supplements. You want to ask the patient about alcohol and recreational drug use, both past and present, because that can influence how they react to medications. You'd want to assist in managing and renewing medication prescriptions if your state allows. And you'd also want to educate the patient using guidelines provided by the provider about the purpose of the drug and how to take the drug for maximum effectiveness and minimum side effects. In a minute, after we're done with this presentation, I'm going to take you guys to the website for New York that discuss the medical assistant's scope of practice. New York tends to be pretty strict in healthcare, not just for medical assistants, but for pharmacists and pretty much any healthcare professional. They are still catching up to some of the more cutting-edge states such as North Carolina that utilizes pharmacists in all types of different manners, and other states that utilize medical assistants in all different types of manners. And we'll talk about what a medical assistant in New York State can and can't do. So the book does mention scope of practice and permit, like how much you're allowed to do, right? And it's important to know what your scope of practice is so that you stay within the legal rights of your position. So to be able to talk about medications to a patient, you must have a basic understanding of pharmacology. So what is pharmacology? Pharmacology is the study of drugs. A specialist in pharmacology is called a pharmacologist, and there are 5 different types of pharmacology. This includes pharmacognosy, or the study of the characteristics of natural drugs and their sources, pharmacodynamics, the study of what drugs do to the body, pharmacokinetics, the study of what the body does to drugs, pharmacotherapeutics, which is the study of how drugs are used to treat disease, and toxicology, which is the study of poisons or poisonous effects of drugs. According to the DEA, which is the the Drug Enforcement Administration, a physician is allowed to prescribe or order, so is a physician's assistant, as well as a nurse practitioner. They can either prescribe or order a drug to be given to a patient. This can either be filled by a pharmacy through the hospital or through the CVS or Walgreens that you guys are used to seeing, in the various areas in our neighborhood. To administer a drug is to give it directly by injection, by mouth, or by any route that introduces the drug into the patient's body. That could be a job that perhaps an LPN or a nurse, or in some states a medical assistant might do. And dispensing means distributing the drug in a properly labeled container to a patient who is directed to use it, usually done by a pharmacist in a pharmacy. And there are various types of pharmacies. Traditional pharmacies dispense common prescriptions. This would be your CVS and your Walgreens. Could also be considered a hospital pharmacy, which deals strictly with patients in the hospital. Compounding pharmacies compound drugs that may not be available on the market by mixing 2 or more ingredients, and the provider has specifically ordered the amount of those ingredients to be put in that drug. Nuclear pharmacies prepare and dispense patient-specific radiopharmaceutical doses for diagnostic imaging and therapeutic procedures for use in hospital nuclear medicine departments. So let's go back to pharmacognosy, which is the source of drugs. A lot of drugs originate as natural products, such as from plants, animals, minerals, bacteria, and fungi. For hundreds of years, medications were made very simply just that way, from the bulbs, roots, stems, buds, and leaves of plants. So one example that you'll see on page 1123 is actually a really, really pretty plant called digitalis. It's the foxglove plant, and it is the source of digitalis or digitoxin, which is a heart medication used to treat abnormal heart rhythms. Another example that the book gives is quinine, which comes from the cinchona tree bark. And I believe many of you are probably familiar with aspirin, which comes from the willow tree. Animals are also used as a source of medications. Some animal substances can be collected, such as thyroid hormones or insulin, cod liver oil, enzymes such as pancreatin and pepsin. And mineral sources yield various substances that can be used as they occur naturally, such as potassium chloride or mineral oil. Bacteria and fungi are used to make certain antibiotics, such as cephalosporins and penicillins, and that's where they originated. Drugs can also be synthesized by chemical methods. Human insulin is produced by those means. We used to rely on porcine or pig insulin, but now we make human insulin by chemical synthesis. So there's many different sources of drugs, and knowing where they come from is sometimes helpful and important in educating your patients. Pharmacodynamics is a study of what the drug does to the body, and it includes the interaction between the drug and the target cellular tissues and their possible receptors. For example, the book gives, patient with diabetes takes insulin. That's basically replacement therapy. Our body makes insulin on its own, so if a patient is diabetic and their body does not make insulin, they can replace it with exogenous insulin, and the drug allows the movement of glucose across cell membranes. And then the body can use that glucose as an energy source. Pharmacokinetics is a study of what the body does to the drug, and this can be summarized by the acronym ADME: absorption, distribution, metabolism, and excretion. Absorption is the process of converting a drug from its dose form, such as a tablet or capsule, into a form that the body can use. In other words, if you took a drug by mouth, then when you swallowed it, it would get broken down in your stomach and absorbed. When drugs are injected directly into a blood vessel, they are immediately bioavailable and do not need to be absorbed, as they are placed directly into the bloodstream. Other routes that we'll talk about in medication administration do require absorption, such as transdermal or inhalation. So keep in mind, anytime you give somebody a medication by intravenous injection, you are giving them 100% bioavailable drug that does not need to be absorbed. Distribution is the process of transporting the drug from its administration site, such as the muscle of an injection, to its site of the action. Distribution is all important because it tells you the amount of time that a drug takes to achieve maximum or peak plasma levels. Metabolism is the process by which drugs are broken down into simpler products called metabolites. This usually occurs in the liver. However, some drugs are metabolized in the kidney, and metabolism can be affected by disease, drinking, a patient's age or genetic makeup, or drug characteristics. Excretion describes the manner in which the body gets rid of the drug. Most drugs are eliminated through the urine, but can also be eliminated through feces, perspiration, saliva, bile, breast milk, or even breathing. Pharmacotherapeutics is a study of how drugs are used to treat disease. This area of pharmacy is sometimes called clinical pharmacology, and we talk a lot about safety, efficacy, labeling, etc. in this particular branch of pharmacology. So an indication is a purpose or a reason for using a drug. The FDA must approve indications before they can become a part of the drug's labeling. The FDA, or Food and Drug Administration, is an agency of the Department of Health and Human Services that regulates the manufacturing and distribution of every drug approved for use in the U.S. Labeling also includes the form of the drug, such as tablet or capsule or liquid. And regardless of category, some drugs may be used to treat several conditions or have several different indications. Sometimes those indications are not necessarily approved, and a drug is used off-label, which is still legal. For example, Benadryl is an antihistamine used to treat allergic symptoms in both children and adults. Because it makes people sleepy, providers might even use it off-label as a sedative or sleep agent. Safety. Safety is important. When we talk about safety, we're usually talking about side effects and adverse effects. Side effects are unintended but fairly mild and common effects of a medication, such as headache, possibly upset stomach, or constipation. Some side effects are common while others are rare, and adverse effects are potentially more harmful and less common effects. For example, Benadryl side effects can include confusion and disturbed coordination, and this may not be tolerable to the patient if they have to drive or work while taking this medication. Adverse effects often require immediate attention and may be a reason for a patient not to take the medication in general. When you're talking to a patient about side effects, we always want to include the provider and bring them into the conversation, because we don't want to tell them all of the listed side effects of a medication. We want to tell them the ones that are most important and most likely to be harmful, so that we can have them call us if those occur. Otherwise, if you gave them a long list of side effects that had ever been mentioned of this medication, it may scare them away from taking it. Efficacy. Efficacy means how well a drug is working, and this can be affected by a number of different things, such as, is the patient taking their medication properly? Is the dose enough or too much? Has the drug had time to reach a therapeutic level? Is it possible that the wrong drug was dispensed or prescribed, which is rare? Is it possible that the patient just has individual factors that are making them not respond well to the medication? Or is it possible that the drug is working adequately, that the patient does not understand that it's working? The last point that says the generic drug does not work, but the trade name drug does. I don't necessarily know if I agree with that. We're not going to go into depth. If you have any questions, please ask. So kinds of therapy. We're going to wrap up with kinds of therapy and toxicology. Kinds of therapy can include acute, such as a drug being used to treat a life-threatening illness. Empiric, meaning you are prescribing it in an effort to target something that you think is going on, such as penicillin for strep throat, suspected strep throat. Maintenance therapy, so a drug is used to maintain health or protect against exacerbations, such as blood pressure medication or an anti-inflammatory for inflammatory bowel disease. Palliative, meaning the drug is prescribed to reduce the severity of symptoms in a condition such as its accompanying pain. For example, morphine given to cancer patients to keep them comfortable. Could be prophylactic, meaning to prevent a disease or condition, such as immunizations or birth control. Could be replacement. We talked about insulin a few minutes ago being a replacement therapy. The book mentions hormone replacement therapy. Or it could be supportive, when a drug is prescribed for a condition other than the primary disease until that disease resolves, such as a corticosteroid for an allergic reaction. Last but not least, it could be supplemental, such as vitamins or minerals, especially for women who are pregnant or nursing. Last but not least, toxicology, which is the study of poisons or the poisonous effects of drugs. We always want to keep in mind that even though drugs are used to treat diseases, they can be poisonous if they are taken inappropriately or if the dose that's recommended just doesn't agree with the patient. We always want to, again, advise the patient of adverse reactions that could happen, but not every single one on the list. Most importantly, the ones that they need to report to their provider. You don't want to cause undue alarm or discourage patients from taking the needed medication. Always ask them if they have questions and if they want to talk to the doctor about the side effects. Or their pharmacist can answer those questions as well. So this was week 1. Very quick, very broad overview of pharmacology and pharmacy in general. As we move forward, we'll be talking about medication labels, prescriptions, Controlled Substance Act, etc. Lots to cover in Chapter 51. If you guys have any questions, please feel free to email me. Otherwise, I'll possibly see you on the Teams optional office hours or the next week 2 lecture. Take care, guys.